On this episode of the Becoming Latina Physicians podcast, I will speak about my experience during my first big girl job right out of IR fellowship training and how and why I decided to pivot 3 to 4 years into the job. Welcome to the Becoming Latina Physicians podcast, a place where I share my journey to becoming a physician, as well as the stories of others in our community to help inspire, mentor, and equip current and future Latinas on their successful journey into medicine. I'm your host, Dr. Alanis, a board-certified diagnostic and interventional radiologist. Join me in our trailblazing community as we share stories, inspire, and mentor each other to thrive in medicine. Get ready to learn, grow, and become resilient, friends. So once I completed my fellowship in IR, which was a 1-year fellowship at UCLA, I got my first big girl job in a private practice in the Central Coast. This was exciting and yet terrifying at the same time. I joined the practice right after fellowship. I worked my butt off for 2 years to make partner. I felt welcomed and I enjoyed working with everyone, from my partners, associates, nurses, techs, to all who worked behind the scenes and actually ran the practice. I covered 5 hospitals that stretched across 60 miles, and I would read diagnostic imaging in between IR procedures. Call was brutal, especially the 48-hour call. During my 3 to 4 years there, I further improved my IR and diagnostic radiology or DR skills, and I became more efficient and comfortable with using a variety of equipment and learning how to jump from ultrasound-guided procedures to CT-guided procedures to fluoroscopic procedures, sometimes one right after the other. There was a good mixture of bread and butter IR, such as port placements, placing drains, and more complex cases such as the reconstruction of veins, pulmonary embolism thrombectomies, etc. I had great mentors, and all of my staff was wonderful to work with. As a Spanish-speaking physician, I was instrumental in connecting with our Spanish-speaking patients. When I first spoke to my first Spanish-speaking patients, the nurses asked me, "How did you learn Spanish?" I had to inform them that I am Latina, my parents are from Central America, Guatemala, and that my last name is pronounced like a la carte and your niece, Alanis, and not Alanis. My patients' expressions changed when they heard my words, and they felt like they finally found someone who could answer their questions. The questions that they were afraid to ask previously. And now they found that they could ask me those questions. We could have an in-depth dialogue about their diagnosis, the procedure, and including the risk and benefits for the procedures, any complications and post-operative care, etc. I ended up spending more time with them. They had so many questions. My staff would actually comment, "It's so great that Dr. Alanis is here because she can speak Spanish. It helps. We won't need the translator phone today." So this is one of the many reasons why I wholeheartedly believe that culture, language matters, because I lived it throughout my life and during my career as a physician. I unfortunately burnt out. Well, why, you may ask? It's my opinion that medicine is not what it used to be. I can list reasons for the burnout. I know that there are many dissatisfied physicians that are currently practicing medicine, either working in the hospital or private practice, and they understand what I was going through. First of all, I remember that call has always been brutal, and as is in other fields as well. So since you're training while you're in medical school, you either have to shadow or quote unquote are expected to stay overnight to experience what call would be like. And up until recently, I've participated in call where I covered 48-hour weekend call and as a partner in the private practice. So what does it mean to be on call? It means that you're available for anyone to call at any hour of the day. And you have to learn to triage emergent, urgent, and cases that can wait until the work week to be completed. The reason why is because you're usually working with a skeleton crew, meaning you usually have 1 or 2 nurses or 1 or 2 techs that can help you with these procedures versus having a whole entourage of people during the business work days, during the business working hours on the weekdays. The hospitalists and other physicians where you work can call you at any moment in time because your mobile device, your phone number, and contact information is listed on the on-call team for that week/weekend. And within 48 hours, you can get called for consults, curbside sessions, wet reads on imaging, paracentesis to emergent postpartum hemorrhage, traumas such as GI, liver, spleen, lacerations that require embolization for revascularization for acute lymphedema. So anyone could call you at any time. So that could be at 11 a.m. for a paracentesis or at 3 a.m. embolization of a GI bleed. So when you're working with the skeleton crew, meaning 1 or 2 nurses or 1 or 2 techs, and most of the time you're sharing the team with other specialties such as interventional cardiologists, you want to be able to preserve the team's energy and ability to focus and quickly act when emergent cases come along. So I would wake up randomly with my heart racing when I was on call, wondering if I'd missed a call or text, because emergent cases require that the call team be present and ready to go at the hospital within that hour. This includes getting ready, driving, parking, seeing the patient or family members, getting consent, signing all of the required paperwork, such as the HMP, orders, post-op orders, etc. And that also includes briefing your nurse and tech on the procedures, requesting any equipment that's not on your quote-unquote pick list for the procedure. And you have to work quickly, efficiently, especially in patients that are bleeding, no matter what time that may be. After a while, you can imagine with all these years of training, you, as I did, develop chronic fatigue. All of these surges of adrenaline and all the chronic stress with elevated cortisol levels repeatedly takes a toll on you after a while. So, there's a joke that we have is that, especially in IR, we can wear lead all day. You're sweating in it. It's heavy. You would think that by now we would be super fit individuals, but, the pounds don't come off and you just gain back pain. Again, chronic stress. So I also remember when I was a surgical intern and I was on trauma call, that year was brutal as well. You could probably get a sip of coffee or a bite to eat before the pager would go off. And you had to throw the food away because you had to join your team to assess the patient, the trauma patient. So there's a saying that holds true today and throughout whatever type of medicine you practice or are in training to practice is always eat when you can, because you don't know when it's the next time you will be able to eat. So it was difficult. It was brutal. I would lose sleep. I was exhausted. Post-call days were also not great. I remember in my 20s, it was easier to bounce back, but now in my 40s, it usually would take 2 to 3 days to kind of level out and kind of find my rhythm again. There's also the idea of having to meet metrics that hospital administrators impose or place on you as a physician, meaning you have to read a certain amount, you have to see a certain amount of patients during the day, you're expected to go to tumor boards, trauma committee boards. And, after a while, it just takes a toll on you because it's time away from your personal time and time spent with your family and friends. The idea of the arrival fallacy was very well and clear throughout my training, meaning that every time I completed something, I would say, well, when I get to fellowship, I will be happy, And when it was in medical school, when I get to residency, I will be happy. But, you would get there and then you would realize I'm not happy. So that is the arrival fallacy, and it's alive and well in medicine. I actually, when you work so many hours with your team, you become close to them because you actually see them more often than your family and friends. So you become close to your nurses and your techs and all the other physicians in the hospital because of that. And that was one of the reasons why it was difficult to say goodbye to my private practice, although I really needed time for myself and to figure things out. The other thing as well that was difficult to get through was the fact that COVID, the pandemic, in 2020 hit us hard. It was devastating. Many physicians lost their jobs. We lost family and friends to COVID. And that's, when really the idea of trying something else came about, was that I realized life was too short. And as physicians, you're replaceable. You can drop dead and literally there'll be somebody in your seat the next day or somebody will fill it. So I decided that, there must be something out there. And I remember in particular that it was post-call when I was just done and I decided to Google coach career change, or life coach. And I actually stumbled across Dr. Naomi Lawrence-Reid's course called Doctoring Differently. And, I scrolled through it and I thought maybe this is a scam. So I would close it and I was post-call some other time. And I finally scrolled all the way down to the testimonials and I found a doctor that I had, I guess, started this journey with a long time ago. And I reached out to her on LinkedIn and we connected and she told me, go ahead and, this is not a scam. Try it out. And she explained to me what she had gone through and how she ended up pivoting. And so all of that is to say that Dr. Naomi Lawrence-Reid has been instrumental in helping me pivot and find the next best step in my life and in my career. She actually lists a bunch of clinical and non-clinical jobs that any physician can do. And I learned that there's so much that we're not taught in medicine, especially during training. And some of this stuff is intentional. So for all of those of you that are in training, just keep an open mind. Maybe just kind of scroll through her website, especially the tab Moneymakers, and just, see what's out there. Because I will tell you, training is brutal. I guess my favorite word is brutal, but it's very difficult. And there's many times that you're going to feel alone. But just remember, these are the things that you have to do to get your MD, your DO, your PA, whatever it is that you're working towards. But eventually you get to decide. So the bottom line is that I was seeking, quote unquote, permission to pivot, to change, to do something different with my skills. And I found her and I found the group, and it's been life-changing. And as a type A personality, a lot of us physicians are a type A personality, and we were and have always been waiting for permission because there are these boxes that you have to check to graduate, to move on to the next step and the next and the next. So, it was a very difficult decision to pivot in the end because I felt guilt in letting everyone who helped me get to where I had gotten so far. I felt like I was letting them down. I felt like, okay, so I've done all these 23 plus years of training and here I am, pivoting, trying to do something totally different or similar or somehow practice my skills. And I learned that my next best step would be locum tenens. And locum tenens, the definition is it's a person who stands in temporarily for someone else at the same profession, especially in clerical work or as a doctor. So I tell people that I'm kind of like a substitute teacher where I fill in for hospitals or private practices that are short-staffed or people that are on vacation or need they're just short and they need somebody to fill for that week. So that is what I do now. It's given me the ability to dedicate time to this podcast, to do other side gigs. Just know that there's so much out there. Clinical, non-clinical jobs that you can do, such as medical writing, medical expert witness work, better medical examinations, etc. And so currently I cover hospitals in Southern and Northern California, or Central California, and I work as, I set my schedule. So I'm in charge of my schedule and I decide when and where and how long and for how much I will be working. I also keep up my IR and diagnostic radiology skills. I've also been able to address my health, work out more because I truly believe that movement is medicine. I love to listen to other podcasts, and particularly the Doctoring Differently podcast with Dr. Naomi Lawrence-Reid and the EntreMD with Dr. Una. So check those out. They are great for anyone who's either in training, aspiring to become a physician or healthcare provider, and to those that are actually in it. Take a look and listen and see, figure out if what you're doing is what you truly, truly want to do. Also, I recommend that you find somebody, a mentor, anyone that you think that will help you through the journey. Because, we do it alone, but you don't have to. Just remember that life is too short and try to enjoy life, do well on your exams, but always have somebody to text, take breaks, exercise, take care of your physical, mental health for sure. You have to. You have to, because like they say, you can't take care of others if you can't take care of yourself. And so do me a favor and write a 1-sentence affirmation in your notebook, journal, or post it and place it somewhere where you can see it daily, because you will make it. I believe in you. We believe in you. Don't let anything stop you. Just keep going. And the other advice that I like to give is remember to change your mindset. When things are falling apart, the saying, when it rains, it pours. You're not feeling well. Things aren't going exactly how you planned. Just remember of the saying, life is not happening to me. Life is happening for me. And try to see the silver lining. Try to see what good things are going to come out of this. Is it going to make you stronger, more resilient? So thank you for tuning in to the Becoming Latina Physicians podcast. Remember, your journey in medicine is not just about becoming a doctor. It's about the journey and the person you become while empowering others along the way. If you enjoyed this episode, be sure to subscribe at Spotify, Apple Podcast, or wherever you get your podcast. And remember to share this with others who need to hear this message. Until next time, keep shining bright. See you at our next appointment.